Hi, my name is Felipe, and I'm going to explain to Mr. John, in layman's terms, the pathophysiology of primary, secondary, and complicated hypertension. Mr. Devon Jones, who is a 40-year-old African American male with a long-standing history of uncontrolled hypertension. Both of his parents died from hypertension, and his mother also had type 2 diabetes. Mr. John is a police officer in a high-crime neighborhood. He stopped smoking about 5 years ago. When diagnosed with hypertension, he states that he drinks several beers every evening and does not pay much attention to his intake of sodium, fat, or carbohydrates. He does not exercise regularly, with the exception of required training for his job. His weight has increased by 20 pounds during the past year, and he reports some shortness of breath with activity, especially when climbing stairs. Well, Mr. Jones, hypertension. According to CDC, blood pressure is the pressure of blood pushing against the walls of your arteries. And according to my textbook, hypertension is a prolonged elevation in blood pressure. It is one of the most prevalent chronic health conditions in the United States, affecting 45.6% of U.S. adults. Hypertension is the leading risk factor for cardiovascular disease. For example, coronary artery disease, heart failure, and stroke. Hypertension is divided into two major forms, primary and secondary. In most hypertension cases, which is 95% in adults, there is no recognizable cause. This type of hypertension, called primary hypertension or essential hypertension, tends to develop gradually over many years. The other cases of hypertension, which is 5%, are caused by an underlying condition. In secondary hypertension, blood pressure levels are higher than in primary hypertension. In secondary hypertension tends to be resistant to hypertensive agents. In essential hypertension, there are factors that we cannot modify, like a family history of hypertension, African American ethnicity, older than 60 years, or menopausal, but also there are other factors that we can modify, like physical inactivity, overweight, smoking, hyperlipidemia, excessive alcohol intake, excessive and continuous stress, and low potassium and calcium. Some causes of secondary hypertension are kidney disease, primary aldosteronism, brain tumors, encephalitis, pregnancy, brain tumors, Cushing disease, drugs, etc. It is important to say that when the cause is treated in secondary hypertension, the hypertension can be cured. Complicated hypertension. Complicated hypertension is defined as the presence of hypertension in patients with damage to target organs associated with cardiovascular risk factors such as diabetes and dyslipidemia, or special situations of complex therapeutic management such as hyperuricemia. Here in this, some complication of hypertension target organ damage, like in the brain, could be a stroke, in the heart, a heart failure, in the kidney, renal failure. Clinical manifestations. Hypertension, particularly primary hypertension, is called the silent killer because many people do not have symptoms. Often, by the time symptoms become evident, the hypertension is advanced or the blood pressure is remarkably high. When present, clinical manifestations include fatigue, headache, malaise, and dizziness, or shortness of breath, like Mr. Devon Jones. Another clinical manifestation that is nosebleed, blurred vision, and palpitations. Many research studies have been conducted on hypertension. Carola et al. States that uncontrolled hypertension in the US is particularly prevalent and devastating among Black individuals who disproportionately suffer the consequences of this condition to a greater extent compared with persons in other racial ethnic groups. One pathologic effect of sustained complicated primary hypertension is the heart failure. Over time, the pressure on the heart caused by blood pressure can cause the heart muscle to weaken and work less efficiently. Eventually, the overwhelmed heart begins to fail. One of the main symptoms of heart failure is the shortness of breath with activity, like Mr. Devon Jones. Direction for improved self-care to avoid the complication. As we said before, there are many factors that we cannot modify, but there are other factors that you can prevent it, like reduce salt to less than 5 grams daily, eat fruits and vegetables, avoid saturated fats and trans fats, avoid tobacco, reduce alcohol, and be physically active every day. And finally, we have the reference, just in case you want to know more about it.